Coming your way is episode 4 of Chiropractically Speaking, the podcast. I am your spine-tingling host, Dr. Prathap Addageethala, also known as Dr. Pratt. And I am happy here to crack open more secrets for chiropractic care. Now, if you're like most people, you have no clue what chiropractic care is. In fact, only 12 to 13% of the world's population has ever seen a chiropractor. So I wouldn't fault you if you didn't know what chiropractic is or what they do. In fact, that's what the number one thing that people say to me when they meet me and they say, well, what do you do? And I go, I'm a chiropractor. And they're like, what's that? So let me shed some light. So let me start by saying that chiropractors are doctors. We're not medical doctors, no, but we are doctors who are trained similarly, at least when it comes to the subject material. We spend tons and tons and tons of time studying anatomy, physiology, radiology, biomechanics, kinesiology, all these types of things that would benefit people who work with people physically. Chiropractors earn a doctorate of chiropractic, a DC degree. And these degrees are only available to accredited institutions around the world. And there's only a handful, more than a handful, a few handfuls. But that being said, these colleges have gone through the rigors of getting accredited through various councils and policy makers. So most of the chiropractors, I'll use air quotes, most of the chiropractors or people who identify as chiropractors on Instagram are not really chiropractors. And I'll say that again. Most, even popular accounts, most of these so-called chiropractors are not actually chiropractors because they don't hold a degree that says that they're a chiropractor. Okay? There are no certificates issued for chiropractors. There are no part-time courses for chiropractors. And there are currently no colleges in India that offer chiropractic training. So I'm putting this out there again. If there is anybody out there who wants to go and study chiropractic, I can help you with that as the VP of the Indian Association of Chiropractic Doctors. If you're wondering about who is a real and who is not a real chiropractor, you can go to the Indian Association of Chiropractic Doctors directory, and everybody who's licensed, vetted, and we know that they're here in India are actually real practitioners. Lots of these so-called chiropractors who have fake qualifications will tell you that I'm a chiropractor and you don't have to worry. I have all the necessary documentation, blah, blah, blah. These people are pulling the wool over your eyes. Do not believe them. In fact, the way I think about this is really simple. Would you take your Ferrari to the Maruti dealership? Probably not, right? Why would you do the same with your spine? You only get one spine, right? You get one spine. There's no such thing as a spine transplant, right? So don't go ahead and trust some random person who claims to be a chiropractor. You know, don't trust your spine with that person. It's okay to ask somebody for their credentials. That's allowed. And the telltale sign for somebody not being an accredited chiropractor is the fact that they'll probably get mad. They'll probably get defensive. They'll probably try to, you know, give you a lot of bluster and try to blow you off. But I would prefer, I mean, as a discerning advocate of chiropractic care, I would be happy if you guys were all extra diligent at understanding who is and who is not a chiropractor. Definitely check the link below and it'll direct you to the Indian Association of Chiropractic Doctors page. And it'll tell you, and anybody listed there is a chiropractor who you can trust. And if somebody who you're going to is a chiropractor, but they're not listed there, that raises significant doubts about their qualifications. Another interesting thing about chiropractic is that it's not all one size fits all. In fact, for chiropractors, a lot of extra training is available. I know lots of people who've gone on to do diplomates in radiology, let's say, or fellowships in international sports and pediatrics. So obviously people who are elite athletes can go and visit a chiropractor who has advanced information on treating athletes. And the same thing can be said for people who are interested in having their children looked at by a pediatric certified chiropractor. We have one of them at Atlas Chiropractic and Wellness. Her name is Dr. Teresa Wand. I would definitely recommend anybody who is thinking about having their child checked to go and see her, because she is excellent. She's made a huge difference on so many people's babies. It's not even funny. And to be honest with you, a lot of people are very concerned about, well, what's a chiropractor going to do with a baby? And why does a baby need to get checked for chiropractic? And the reason for all of this is because babies have spines too. Babies have nervous systems too. The birthing process is a little traumatic. It can be very, very hard for a little nervous system to understand what the heck is going on. So chiropractic is basically all about potential, which we'll get into. It's all about potential. So if the potential of this baby's spine and nervous system to function better, to develop faster and better, is influenced by very, very gentle pressure. I'm saying gentle pressure, enough to just change the shape of a grape without splitting the skin. That's how gentle pressure is used on pediatric chiropractic adjustments. So you should definitely trust the process when it comes to getting your child adjusted. It's not a wild and crazy cracking at all. It's really, really gentle. It's really, really simple. And it's really all about letting the little baby function at its best. Even my own children were adjusted when they were first born. So it's also something that I practice, not just preach. And that brings us back to, what is chiropractic? Well, in a nutshell, and it's really difficult to make this into a nutshell, so I'll try my best so that it's understandable and relatable to all of you. But chiropractic is most interested in the relationship between the brain and the body and the signal that passes between the brain and the body, i.e., the brain will send signals to the body to execute various functions, to do different things. And that signal passes through the spinal cord. The spinal cord lives inside a set of ringed bones that's known as your spine or vertebral column. That is, in essence, why the spine is the central moving point of chiropractic. Chiropractors use specific hands-on adjustments to the spine, little modifications, little alignments to the spine to ensure that that signal between brain and body passes smoothly without any interference or irritation. These small restrictions or misalignments in the spine can be known as subluxations. And restoring the order of the spine, restoring the alignment of the spine helps to improve function, reduce pain, and increase mobility. If you've watched episode 1, you know what a subluxation is. If you want to go back and watch it, here's the link right there. And you can go back and watch that. In the comments, I have a little trivia for you. If you can remember who coined the phrase subluxation, leave it in the comments below. Okay, coming back. Now, let's say your Wi-Fi was bad and your video was playing like this. Stupid and annoying, right? Subluxations or restrictions or these kinks in your spine basically delay that signal, preventing that ability of your body to transfer information smoothly. So if I wanted to maybe bend my finger like that, maybe the signal was distorted if I had a restriction in my neck. So the nerve signal going from brain to body might say, okay, I want to do this. I'm bending my finger slowly for those of you not watching. And imagine my finger slammed shut. It bent really quickly and stayed in a bent position. Whereas my intention was to raise and lower my finger or bend and straighten my finger smoothly at an even pace. So these are the things that restrictions in your spine can do. And I'm talking about this on a really simple scale. This also can affect your organs, your internal functions like regulating your hormones or your immune system. So this is why we always think about chiropractic care in terms of optimization. If your spine has these restrictions, it could be less than optimally running. And the idea of getting chiropractic care is to correct those misalignments, subluxations, restrictions into improving the signal between brain and body the way it's meant to be. It's kind of like moving the router, to a better location so that that signal can spread evenly and everywhere gets nice, fast connection. So then people wonder, is it all about the cracks and pops in chiropractic? Is that what this whole thing is about? If you get that crack, then you get good alignment. And if you don't get that crack, you're still screwed. It's not like that. Chiropractors have over 200 or so techniques that are available to them. Some of them which involve the cracking of the joints, which we call chiropractic adjustments, which are small, mechanical, specific thrusts to the spine, which we like to call HVLA, or high velocity, low amplitude thrusts. Let me get a little bit of a demonstration for you. Yeah. This was my friend in college. So this is more for our YouTube audience who can see what I'm doing here. Hopefully on the podcast, this is not too confusing to understand. But the idea is that I'm demonstrating where these issues or what a chiropractic adjustment does. So we're looking at a three-dimensional representation of the spine. And I am just kind of gesturing and pointing to different areas of the spine. Right now, we're looking at the back of the spine, and there's a particular area where joints of the spine overlap. So these joints here, you can see it overlapping. Those joints are called facet joints. And facet joints are laid together like the shingles of a roof, the tiles on a roof, where they kind of just slightly overlap. At that junction, you have to use your imagination here, but at that junction where that overlap is happening, there's also a very mobile sac that sits on top of it. It's a very, very soft tissue. And within that sac is a type of fluid. It's a very slippery fluid that allows the two surfaces to slide over each other smoothly. We call it synovial fluid or joint fluid. That joint fluid helps to obviously lubricate the joint, but dissolved inside that fluid is something called, nitrogen. It's just gas. And the whole idea is that if we move the joint, which we do when we're doing a chiropractic adjustment, the shape of that sac slightly deforms, which allows gas to escape the sac, making that characteristic popping sound like these. And the idea behind that is that not only does the joint that was restricted previously get moved better, but it also allows some of that synovial fluid to slide in between the joints, making it more slippery and therefore more mobile. So definitely check out my simple explainer video on Instagram. That kind of makes it a little simpler and more visual for those of you guys who are more visual. But that being said, from a podcast standpoint, we're still working out the kinks on how to make this a little bit easier for you to understand. So hopefully I made that kind of clear, and your anatomy is very, it's in your head so you can visualize everything I just said. And if not, you can always go to YouTube and you can watch my demo again. It's really simple. All right. So chiropractors are not lone wolves in the healthcare industry. We love to work with other healthcare practitioners, whether they're medical practitioners or other people in the non-allopathic space or the holistic space. At least in my case, I'm extremely happy to collaborate with lots of different professionals in solving cases. My whole philosophy revolves around helping the patient. And if the patient gets better with whatever issues they're having, or even if they're not having any issues and they just want to maintain their health, wellness, this is something that other practitioners can also help with. We're huge proponents of mental health, nutrition, physical activity, all of the above. So if there's other practitioners we can liaise with in terms of getting a patient across their threshold of limitation, that's what we're all about. Another thing, chiropractors are not always right. There's never only one solution to the problem. And we're okay with that. This is a situation where you are going to benefit from the mobility of your spine. You are going to benefit from the optimization of your spine. All of the research that we've looked at tells us that chiropractic is safe and adverse effects are rare. However, in terms of pain, it affects us in different ways, especially when we're talking about pain. Pain is a biopsychosocial construct, which means it can affect us physically, it can affect us socially, and it can affect us mentally, psychologically. Pain is one of those things that can come from nowhere. You know, you've often heard that phrase, you can't get something from nothing. But I'd like to introduce the idea of stress. And stress, well, what is stress? Stress is a thought. Stress comes to us via various factors, whether chemical, something we ate, mental, somebody's called you a bad name, or physical, you laid on the couch all night. One of those things can cause stress, or all three of them can happen at the same time. Stress induces a cascade of biochemical reactions, which leads to inflammation in the body. Inflammation in the body increases pain. So there's a very simple, straightforward pathway from stress, which is nothing. It's a thought. Don't get at me, Dan Brown truthers. But a thought is not matter. It holds no weight. It doesn't exist really. It's a thought, but it can become a physical sensation through this chemical pathway of inflammation. So it's extremely important for us to understand all the natures of pain before we decide that chiropractic is or is not for us. Chiropractors can help decide if chiropractic care is good for you or not too. A lot of people come to us expecting to be cracked where they are actually not good patients due to some health risks or concerns. Chiropractors are really well trained at spotting risks and basically educating patients about why they may or may not make good patients for chiropractic care. So just know that whenever you come to a chiropractor who's licensed and certified, your health is their main concern, and they are going to make sure that they check for all the right things before they treat you. Another thing that chiropractors do really well is basically spine puns. So when do you think the next episode is? You got it. Next week. Okay. Yeah. Before you guys get at me with hate in the comments, I will make sure that nobody's neck is weak. Okay. So if you come see me, we'll fix that. Until next time, I'm Dr. Prathap, and this is Chiropractically Speaking, the podcast where we talk straight and get your health work. That's it for today. I mean, it was a simple and clean episode, I hope. And, if you were listening on the podcast and you'd like to learn a little bit more about the anatomy of the spine and how a chiropractic adjustment can affect the spine, I do encourage you to go check out our YouTube video on this episode so that you can see what I was doing while I was demonstrating. All right, guys, that's a wrap for me. And thank you so much for sticking with me through the episode and for this entire season, actually. So if you like what you heard and you think it's valuable, please do share it along with your friends. Don't forget to like or subscribe or both, and leave us a 5-star rating wherever you get your podcasts. It's been fun hanging with you, and I'll catch up with you next week on Chiropractically Speaking. Good night.